Welcome to the Borno Health Update. I'm your host, Ibrahim Amarawa. On our program, we track the advancements in the healthcare under Governor Zulum's administration. In this episode, we focus on the transformative efforts spearheaded by Professor Baba Malamgana, Commissioner of Health and Human Services, who is driving innovations and resilience in our healthcare systems. Maternal mortality remains a critical and pervasive challenge in Nigeria, particularly in the northern region, where Borno State stands at the forefront of this crisis. No woman should die while giving life, and no child should perish from preventable diseases. This is the vision that Professor Baba Malamgana has been working assiduously to achieve in Borno's healthcare sector since his appointment as a Commissioner of Health in 2023. Professor Baba Malamgana, alongside his team at the ministry with the support from partner organizations, initiated many policies and programs aimed at drastically reducing maternal mortality rate in the state. One of the most outstanding innovations is Safer Birth Bundle of Care, SBBC, which was adapted from Tanzania. This program has proven to be a game changer, successfully transforming the grim reputation of not only Borno State, but also Nigeria as a whole regarding maternal mortality. During the opening remark at the end of the year review meeting for the SBBC pilot program, the Commissioner outlined the journey so far. This follows a year of hard work, unwavering commitment, and sacrifice by the Minister of Health with the critical support from NORAD, Ladel Global Health, and NCA in implementing the initiatives.
Today is not merely the conclusion of a project. It is an opportunity to celebrate a journey of innovation, partnership, learning, and government leadership in our collective determination to reduce preventable maternal and newborn death in Borno State. The story of SBBC in Borno did not begin with today's meeting or even with the launch of the program. It began with a vision shared during the inaugural meeting of the Northeast Commissioners of Health Forum, hosted here at the International Conference Center, Musa Usman Secretariat, in January 2024, where maternal mortality emerged as one of the region's greatest public health challenges. During that meeting, we were introduced to the remarkable experience from Haydom Lutheran Hospital in Tanzania, demonstrating how simulation-based learning, quality improvement, and innovative clinical tools could dramatically improve maternal and newborn survival. Inspired by that experience, the Commissioners of Health committed ourselves to learning directly from Haydom through a peer-to-peer exchange. And that visit transformed our thinking, learning, and quality improvement into one integrated approach. We returned to Nigeria convinced that this was an innovation worth adapting, and not only as another project, but as a government-led reform for safer childbirth. On the 15th of April, 2025, Borno State officially launched the Safer Birth Bundle of Care at Malak Chandler Primary Healthcare Center. The event was graced by the Executive Director of the National Primary Healthcare Development Agency, Dr. Moi Aina, representing the Coordinating Minister of Health and Social Welfare, signifying the strong national endorsement of this innovation. The launch also marked the handover of SBBC simulation equipment and clinical tools to the government of Borno State, reinforcing our commitment to institutional ownership. This equipment was donated to Borno State by the Norwegian government through NORAD with NCA or Norwegian Church Aid as the implementing partners. We deliberately began with a pilot for high-volume facilities across Metropolitan Council and Jere. These facilities became centers of excellence where healthcare workers embrace simulation-based learning, continuous mentorship, quality improvement, and the use of innovative technologies such as Moyo, Neobit, Mama Natalie, Neonatally Life, Upright Back, and other life-saving tools.
The Honorable Commissioner further acknowledged the tremendous support the healthcare is receiving under Governor Zulum's administration. He added that this backing has positioned Borno State and the SBBC initiative as a benchmark for other states to the extent that the program is now being endorsed at the national level as one of the major healthcare reforms in addressing maternal mortality rate in the country.
We therefore aligned SBBC directly with the Nigerian Health Sector Renewal Investment Initiative and the MAMI framework, ensuring that quality improvement became an integral component of our broader maternal and newborn health reforms rather than a stand-alone intervention. What is particularly gratifying is that achievements of Borno have not remained within our borders. Our experience has been presented and shared at numerous local, regional, and international platforms. We have showcased Borno's experience during the Gates Foundation Maternal and Newborn Health Partners meeting, integrated SBBC into our national operation plan as part of our health sector reforms, and proudly presented our work during the World Health Assembly in Geneva, where Borno State received standing ovation for our trajectory in healthcare. Similarly, we showcased Borno at the Nordic African countries meeting in Stockholm, in Sweden last year, and made presentations on Borno's healthcare reforms, and we also received standing ovation for this. We're equally delighted the Borno SBBC has been submitted as part of the Nigeria's state-to-state learning, and many other states are joining on board. This is how sustainable health system strengthening should occur, not through isolated projects, but through government ownership, institutionalization, continuous learning, and strong partnerships. On behalf of His Excellency, Professor Babagana Umara Zulum, CON, MNI, FNSE, the Executive Governor of Borno State, I wish to express our very profound appreciation to all our partners who have made this journey possible, especially the Norwegian ambassador to Nigeria, who hosted me twice at dinner in his house, and the NORAD, who graciously, I had meeting with them in Sweden for making this possible.
That was the Honorable Commissioner for Health, Professor Baba Malamgana. Indeed, he has orchestrated a remarkable turnaround. His leadership has been instrumental in delivering this monumental progress in maternal and child health, not only across the Borno State, but throughout the country at large. In his address, the representative of the country director of Norwegian Church Aid, Dogo Arthur, attributed the success of the SBBC in Borno to the collaborative efforts and shared commitment between the Borno State government and the NCA team. Furthermore, the project manager provided a comprehensive overview, walking participants through the project's journey, operational procedures, and the key successes recorded during its implementation.
I'm actually proud of the achievements or the progress we have made so far. The program have made maternal mortality reduction by 51% and also neonatal mortality by 68%. Trained more than 160 health professionals through low dose, high frequency, and also simulation based trainings on a routine basis. We have trained 4 mentors. The program supported 1 mentor to be upgraded into faculty, while the rest are also on the process to become faculty.
SBBC is an evidence-based project that is actually designed to strengthen the healthcare system. We have training corners in each of the facilities we implement. So for sustainability aspects, we use the government staff that are already working in the facility we're implementing SBBC. These, they are low-dose, high-frequency data for practices have been uploaded into the Liveboard. It is a dashboard that we have access to check if they are actually doing the training well or if there's any problem. And also, we've seen a great impact in positive pregnancy outcomes.
The SBBC review meeting was graced by eminent leaders and principal stakeholders within the Nigerian health sector. Distinguished attendees included Dr. Salman Askolo, advisor to the President on health matters, and Dr. Dayo, National Coordinator of the Maternal Mortality Reduction Innovation Initiative, MAMI, who participated virtually on behalf of the coordinating minister. Present in person were the Commissioner of Health, Sokoto State, Dr. Faruk Umar, and the President of the Nigerian Society of Neonatal Medicine, Professor Maria Mukhtar. In their remarks, the dignitaries collectively lauded exemplary leadership of Professor Babagana Umara Zulum in prioritizing healthcare development, while also commending the Commissioner for his instrumental role in these laudable initiatives. They described the 1-year implementation of the SBBC program as eminently worthy, noting that Borno State has set a remarkable precedent by becoming the first subnational entity to pioneer the initiative, following its benchmarking visit to Tanzania.
And when I received an invitation to attend this important review meeting, where we review and see the success story that has obtained the last 1 year, there's no surprise, because Professor Babagana is a man of excellence. And let me make it clear, even at the forum of our commissioners, one professor already not there, you know that it's a gap. And the journey so far, I was in Tanzania, I was here, see things ourselves. So if I could be down there, why not in Borno to come and see these investments so that we'll be able to put our SLB in the right path. Since our journey, our visit to Tanzania, substance has swept into action. We are able to have support from the UNICEF under the EU SERA project. And as success now, a number of initiatives have commenced to put SBBS in 8 facilities in Sokoto State. 1 at the tertiary level, 1 at the secondary level, and 6 at the primary healthcare level. 2 from each senatorial zone. We've identified, trained 26 facilities champion. We've identified 5 mentors. We also identified 2 biomedical engineers that we also. We have already commenced partnership with Ladan to supply the necessary equipment to put the SBBA in the state. And am I present here with my team? It's a testimony to come and see how the success story of made in Maiduguri. And therefore, you need to congratulate my colleague for the success that he has already. I am confident more success will be put in place to see as during the leadership of health in my group state. And not surprising, also because of the enormous support of his principal, is the executive governor, with the amount of commitment that everybody in this country.
I would like to recognize my sister, Dr. Selma, who is online, and Dr. Dio from the Federal Ministry of Health, MAMI Project, as well as all the medical women here present. We're always selfish, but it's okay, it's allowed. We're here for the mothers and the babies. So I recognize all of you, my medical women. I'm particularly very grateful for this invitation, Honorable Commissioner. I'm here to represent the Nigerian Society of Neonatal Medicine. It's a society of all the doctors in this country who look after the newborns. And we're healthcare workers that are present across the country, and that brings with it great advantage when it comes to programming and execution of projects. There's always one of us to help when we're called upon. But we're here today to celebrate Borno State. And I'm particularly delighted that I was a part of this journey way back in 2003 or 2004 when we went to Haidom under the leadership of the Federal Ministry of Health. And let me state that there were quite a number of us from the federal government, from various states. However, Professor Malam Babagana came back home with such a positive zeal that before you could say Jack Robinson, he had put in place the first SBBC program in the whole of Nigeria. And for that, I think he deserves a special round of applause.
During the review meeting, notable contributions were made by key officials, including the advisor to Governor Zulum on health matters, Dr. Abubakar Hassan, alongside Alhaji Zanalo Maina, district of Damboa, which also serves as a Borno State Emirates focal person on health, as well as the chairman of the Maiduguri Metropolitan Council, who is also Algon chairman Borno State, Ali Bolori.
Started as partners, and what we are in fact looking at it is an exit strategy. That is what we are doing today. Exit for NCA, continuation by the state government. So you can see that we already have a budget line We have a work plan. The Safer Birth Bundle of Care is integrated into the normal day-to-day activities of the State Ministry of Health and its parastatals, namely the Hospitals Management Board that takes care of the secondary referral centers and the Primary Healthcare Development Board that takes care of our primary healthcare facilities. So it's going to be a seamless transition. There are not going to be hiccups, but the big task ahead for the Ministry of Health is what we call the sustainability aspects, namely upscaling, making sure that this intervention in the labor room goes to many more facilities across all the local governments in the state. And that has been taken care of in the plan, the operational plan of the State Ministry of Health, and it's also in the budget line.
Actually, this program, I think, I will say something on behalf of all chairmen of local government, 27 local government, because I'm the outgoing chairman. So this program, I think, is ours. So inshallah, we're going to give all support. And then I will appreciate our commissioner to initiate this end of the year review meeting. So inshallah, we're 100% with you anytime, any day. All the 27 local government chairmen, their door is open for health. Because without health, I think there is nothing.
A comprehensive presentation reflects with the detailed data and photo exhibition of project activities was delivered to the participants of this review meeting.
And this is training Sim Begin Level 1 for the added facilities, because the 4 facilities we started SBBC traveled to Gombe, and these facilitators are from Haidom, Tanzania. They came to train them on Sim Begin Level 1. This is Mariam Abacha Memorial Women and Children Hospital, and this is the MD, and this is the day we hand over mannequins for their training corners, because we added 2 more facilities after the 4 facilities we started implementing SBBC.
Delivering his closing remarks, Dr. Shatima Maina Muhammad, Permanent Secretary of the Ministry of Health, expressed profound appreciation to the partners for their unwavering support and extended heartfelt thanks to all who come from far and near to honor the occasion.
For the Safer Birth Bundle of Care, SBBC, it has been a very eventful and fruitful year, not only in Borno State but across Nigeria. The objective of this annual review meeting is to make an appraisal of the milestones, challenges, and possible next steps in improving its implementation. The Safer Birth Bundle of Care SBBC is now universally accepted as an effective strategy for reduction of maternal and neonatal mortality. And of course, it is also a tool of attainment of universal health coverage. I'm also glad that Borno State has pioneered this effort in Nigeria, and indeed our Honorable Commissioner of Health, Professor Baba Malangana, is now the face of SBBC, not only in Africa, but across the globe.
That was Dr. Shatima Maina Muhammad Eminai, Permanent Secretary of the Ministry of Health. In a subsequent post-program interview, the Commissioner of Health offered additional insight on the significant progress achieved so far.
We're doing this program for the last 1 year, and this review has revealed that we have reached a very important milestone. We have seen reductions in maternal death. Pregnant women were dying needlessly. Borno State used to be or has been the third highest in Nigeria in maternal death and newborn death. And Nigeria happens to be the highest in the world in terms of maternal death and newborn death. So a time came that we have to change this trajectory. And that is how this started with the meeting of Northeast governors, Northeast commissioners of health, and the visit to Tanzania, which culminated in this. The reduction in Tanzania was 75% in maternal death and 40% in neonatal death. And this 1 year in Borno State, in 4 facilities, Specialist Hospital, Gwange Maternity, Malaka Challa, and the Yerwa Clinic, has demonstrated that we have reduced maternal mortality or death of our pregnant women by 59%. Nearly 80% stillbirth has been reduced. We've also seen that we have been able to save newborns when they come out from the birth canal. We put on digital, neobit, which can pick up their heart rate, whereas previously that facility did not exist, and therefore the newborn would be looked as dead on arrival. But now with this device, we can say, yes, there is heartbeat, therefore they go into resuscitation mode. So overall, it has been very impressive, and we really owe gratitude to His Excellency for allowing this program to come to the state, for his support in making sure that this program carries on in the state.
Thank you for joining us. Stay tuned for the next week's episode, where we'll explore more innovations in the healthcare sector. This is Ibrahim Amarawa, reminding you health is wealth, and Borno is on the rise.